Thank you for tuning in to All About the Girls, the podcast, where your host, me, Jenny Craig Brown, interviews incredible women to learn what powers them, what inspires them, and how they make our world a better place. Let's get to it. Welcome, everybody, to another great episode of All About the Girls, the podcast. Thanks for joining me today, ladies. Today in the studio, again, we've got a little bit of a different episode. These next two episodes will be with more than just one female with me. So today we have Dr. Siatras. Welcome.
Thanks for having us.
Thank you. And we also have Dr. Jackson Johnson. So thank you both for joining us.
Happy to be here.
Yes. In the podcast land, we are recording, of course, earlier. We're not live, but this will launch in September. And of course, I mentioned doctors. So as you guys know, that is the big Breast Cancer Awareness Month. We're doing a lot of work, so we wanted to start even earlier and get ahead of that. So tell me, us and our listeners, a little bit about each of yourselves, who you are, what you do as a doctor, and any specialties you have.
Okay. I'm Dr. Siatras. I am a radiologist. I work at Methodist hospitals. And we cover the Maryville community. We have a campus in Gary, Indiana. We also have an outpatient center in Cherville. And our job, I should say my job, is mammography. That is my specialty. That's what I did my fellowship in. I look at mammograms every day. I look for cancers. I try to find them at the earliest stage possible. And when cancers are found, I get to work with this lovely person to my right. And I'll let her talk a little bit about what she does.
Yeah, Dr. JJ,
quick.
Tell us more. She thought you were going to go on.
You only started. So I'm Dr. Jackson Johnson. Most of my patients and colleagues call me Dr. JJ. My mother named me that. It works. And I'm a general surgeon. I am a member of Indiana Surgical Associates. We're a group of about 16 surgeons. I say about because the number keeps changing. We're getting more and more surgeons every year. But we serve Northwest Indiana at 4 different hospitals. I primarily work at Methodist Hospital, both North and South Lake, and I do get to work with Dr. Siatras often with breast cancer patients. About 30% of my practice is breast cancer. Wow. I do a plethora of other things, hernias, gallbladders, things like that, but I do have a passion for taking care of the women of Northwest Indiana as it relates to breast health and breast cancer.
Wow, incredible. So as we head into this big month where I'm certain you guys, everybody has a lot of promotions as healthcare entities about breast cancer, women's health, all those things. Tell us a little bit about breast cancer, early detection, why to do it. Like dive right into those things, because what I think I've learned from Methodist Health as a whole is that prevention is important. You said it early.
It is.
Early detection is really important. Tell us a little bit about that in the mammography world, probably first. Start there and what that means, and maybe dispel some rumors for us. Get us ramped to do this.
Yes.
How about that?
Yes. Well, you are absolutely correct. Early detection is the key. If breast cancer is found early, it has a 99% survival rate. Wow. So stage 1 breast cancer has a 99% survival rate. And I say that multiple times because it is true. I think we are so past the stigma that a diagnosis of breast cancer means an automatic death sentence, an automatic mastectomy, an automatic chemotherapy for months and months and months. Some cases, yes. But what we try to do, as I said before, is find breast cancer at its earliest stage before you can feel it. If you feel it, there's already a 30 to 50% chance it's gone to lymph nodes. So what we do with a mammogram is it gives us a look inside the breast tissue, find those abnormalities that are small that you can't feel. And that way we give women the best chance at survival. And what I like to tell my patients is breast cancer should just be a speed bump in your road to life.
Okay.
It is diagnosis, it is surgery, it is treatment, and then women should go on to have the life that they're destined to have. And that's why we encourage women getting their screening mammograms done every single year. We recommend first one at 35 as a baseline, and then every year starting at 40 until the recommendations tend to be until you have enough other issues with your health that you would not be able to undergo surgery or therapies, but there's really no clear age limit of when to stop. Women
Probably
used to say
forever until
74,
told
but
otherwise, yeah.
we see very healthy women in their 80s and women in their 90s who still
Yeah.
come in for their mammograms, and why not?
That's a great point. That's a great point. Why not? And what you do every day, you mentioned you have a big passion for women's health. Tell us a little bit more about that and how that ties into this conversation today.
So I'm a surgeon.
Yeah.
Right. So my job starts after women have received a diagnosis of a breast issue. And so that could either be a benign process, like a fibroadenoma in a young woman, or it could be something as advanced as a stage 4 breast cancer, and they need a portacath inserted. So you have everything in between, including breast surgeries. Right. Some of the breast surgeries are limited to just essentially removing the tumor and checking lymph nodes, to removing the entire breast and working with a plastic surgeon to reconstruct the breast.
Wow.
So it can be a continuum of ways to address breast issues. And so when I see women, I want to see them early. I want to see those early, stage 1 breast cancers, or even precancerous lesions. I want to see women with high risk benign breast lesions, meaning we found a ditzel. Dr. Siatras found something tiny, and we just want to get it out to make sure that it's not something more concerning. Those women, sure, they're scared to death, but there is nothing like having them come back to the office after an outpatient procedure where I do an excisional biopsy. I call them, just think of it as a big biopsy. I tell them, it's just a biopsy, getting more information. There's no better feeling than being able to tell them it's either not a cancer or an early cancer.
And when you deal with a patient in the surgery level, it doesn't necessarily mean it's cancerous.
Exactly.
So you'll go in and you'll need to work with that patient even for benign things.
It depends on the diagnosis. I see women who come to me just for breast pain, right? So there's a group of women who come for breast pain, and many of them have fibrocystic breast or dense breast tissue, and we talk about things that they can do with their diet and nutrition and herbal supplementation to minimize breast pain, like eliminating caffeine or using vitamin E or primrose oil. There are lots of things we can do for benign breast pain. And then, like I said, mammograms sometimes identify precancers or things that are associated with cancers, and we can't leave them there sometimes. And so they asked me to do a big biopsy.
Got it.
And then we get it out of the picture so that those women can return to their routine screenings. Yeah.
That's amazing. And so you probably see on the pre-detection how that's got to make you so excited, because you're saying, yes, I still need to do this procedure, but you could probably tell.
I can tell you
that
from
that
the
early
biopsy.
detection, that early detection happens.
That's why you're here. So when a woman comes in, even with the ductal carcinoma in situ, it's a stage 0 breast cancer.
Okay.
I like to tell women, if you're going to have a breast cancer, this is the one you want to have.
That's the one to have.
Yeah.
If my sister's going to have a breast cancer, I want her to have a stage 0 breast cancer.
And I've never even heard of that brought up, so that's really interesting to know.
But that's why we do early detection, to find
yes.
precancers and early cancers.
Okay. So tell me some of the rumors of your process, probably detection and surgery, that maybe scare people away, and why they're rumors and why they're false.
I think we hear them every day. One is pain. Oh, I heard from my neighbor's cousin of how painful this mammogram was. I can't do it. There's no way I could tolerate it. I mean, it's not a picnic. We're not gonna sugarcoat it. They have to compress your breast. Yeah. It is uncomfortable. They've made the machines a little bit better, the plates a little bit better. There's not as many sharp corners and the such, but it's worth it. It's worth it because you're trying to detect. We see other kinds of rumors and myths of, I don't feel anything, there's no reason. I can even picture that patient sitting in front of me and she's touching her breasts all over. I don't feel anything wrong with them. I don't know what you're talking about. I don't know what you see. But that's the whole point. We want to find things before anybody.
Because if you're finding it early,
yes.
that's because there is no symptoms. There's no signs.
Exactly.
You can't feel anything because it's small enough, right?
Everybody can Google the breast cancer symptoms of one breast all of a sudden looking larger or smaller than the other, the nipple getting retracted, just a harder appearance of the breast. Those are more advanced stages of breast cancer. We don't want women getting to that point. Because that is definitely a more complicated case. It will require more therapies. We want to find it before it gets to that point. Right. The other one I always talk about is I have so many women who just can't believe that there could be something abnormal and say, but there's no history of this in my family.
Mm.
And I always say 70 to 80% of breast cancer has no family history at all.
Really? I didn't
70
know
to
that
80%,
either.
none. Only 20 to 30%. And 5 to 10% of that breast cancer has a genetic component. We heard so much about Angelina Jolie years ago having that gene for a breast cancer mutation, BRCA gene. It's very common to hear about it in the news. That's a very, very small subset of breast
Okay.
cancers.
Interesting.
Yes.
Wow. And what are some of are there reasons that women should be more proactive? You mentioned dense breast tissue, things like that. Are those reasons that you should start earlier, or are there any other reasons that say, hey, you might be at a higher risk, therefore start this checkups earlier?
So any woman who has a first degree relative of breast cancer, so mother or sister,
Okay.
we recommend that she starts her mammograms 10 years before that relative was diagnosed. For example, if a woman has a mother who was diagnosed at 37, we recommend she starts her mammograms at 27.
Okay.
And not just her mammograms, she needs supplemental imaging, ultrasounds if she has dense breasts, but also MRIs. She's going to be high risk. And in our high risk patients, and that means a greater than 20% lifetime risk of developing breast cancer, because we do a risk assessment on every patient, we recommend that they alternate between getting a mammogram and an MRI of their breasts every 6 months.
Wow.
So if you're getting a mammogram in January, you're getting an MRI in July, and you keep that cycle going. And that way, every 6 months, there's some imaging going on.
Fantastic. Any others that you wanted to mention that you might hear, whether it be rumors or reasons to start early?
Yeah, one of the things that I've heard in the practice, because by the time they come to me, we're considering some sort of procedure. I have had many women say, if you open this, it's going to spread. And that's not with just breast cancer. That's other types of cancers. There's a myth in different communities that, especially in the African American community, I have heard this, and in the South, because I'm from the South. If you open me up, it's going to spread. When the air hits it, it's going to spread.
That's what's going to make it spread.
And that is a myth. What it pulls back to is that many times people present late. So you have a grandmother or an uncle or an aunt who waited until they had stage 3 or stage 4. And by the time they got to surgery, sure, the cat was out of the bag. They had advanced disease. But in the history of the family, in the shared history, it happened when that surgeon opened grandma up, right? So we just have to always make sure that we go back to the facts, right? So you bring them back and say, well, what do you know about how long it had been there? What do you know about whether or not grandma had gotten an exam or a mammo, right? And then they start kind of piecing it together. Maybe she's right. Maybe I am going to do what I need to do to take care of myself. Yeah. So there are lots of different myths out there.
And you mentioned some holistic, kind of more natural ways to assist folks early on. Talk a little bit about that. I personally just love any doctor that wants to take that holistic approach first. It's just near and dear to my heart, and I think a lot of women feel that way. What are some of those you mentioned, kind of peeked into earlier? So
what I like to do is, I'm classically trained. Like I stick by the guidelines, the book, right?
Sure.
But what I think is important is that you communicate with people in a way that respects their beliefs, their culture, their history. My grandmother was an herbalist, okay? My grandmother went to the woods in Snow Lake, Arkansas, and picked leaves and made poultices for people who didn't have access to health care. So I have a respect for that, right? Now, we understand that a lot of the medications are derived from plant sources. So when people come to me and they say, I'm on this herb or that herb, and we see that a lot in breast cancer, and they say, I can be cured with this. I say, you know what? Talk to your oncologist. We're not going to stop your... I'm not going to say the name of the herb, but I'm not going to stop this herb.
Right.
I'm going to ask that you talk to your oncologist about whether or not there's a potential interaction. And then we're going to offer you standard of care. Because we have studies that show that this increases survival. Does that make sense? And so I try to make sure that I respect other people's beliefs when it comes to naturopathic things. We know that obesity increases your risk for breast cancer. We know that smoking and other toxins increases your risk for breast cancer. So we talk with our patients about lifestyle, things they can change. You know that processed meats increases and exposure to nitrites can increase your risk for cancers. So I say, you like holistic approach? Let's start with nutrition.
Yes.
Let's start
So
with what
smart.
we put in our mouths.
Yeah.
And then you tell me about your herbs. So it's a back and forth.
It's a give and take.
It's a give and take.
Communication is so key.
Yeah.
Okay. And that, I mean, it sounds like at that early detection. So it's almost.
Or before.
Yeah.
It starts with the medical home.
Okay. Tell
and
me.
I know
yes,
you were going to get
more.
there.
Yep.
But that's where it starts. So by the time a person gets to the mammogram or to the surgeon, I believe in the vast majority of those cases, a practitioner has led them down that path.
Sure.
Most women are not self-referred. So a lot of times we need to make sure that we are encouraging people to establish a medical home. Just because you're in your 20s doesn't mean you don't need a doctor, or in your 30s. Like, we have to make sure that there's the gap between the pediatrician and the primary care doc, that we close that,
Okay.
and that we continue to push people to stay with the primary care provider. And the primary care provider has to be relentless in encouraging screening. You can't take no for an answer. You can't take
It's
lack
not just,
of
hey, you're
access.
40, you should do this. It's much
so
more
you
than
say, here, you take some of these little, Dr. Siatras has flyers here for breast cancer screening. You give it to your patient. You say, I want you to do this. The next time I see you, we're going to talk about the result. Like, you show enough compassion to take the extra time to tell people how important these things are. You dispel the myths in your office, in your primary care office. You talk about how, mammograms have changed. I talked to Dr. Siatras, and I did my mammogram as a woman, right? We get to say that. Yes. I did my mammogram last year and what it was like. So it starts in the medical home before you see us.
Yes.
Yeah. Okay. So getting that. And then what are some common reasons you think people aren't coming in? As you mentioned, the pain. What are some other reasons? Because what we're seeing now and what I'm learning through your guys' avenues are women aren't coming in at a rate they should. So if we're hitting, and I don't know, you guys probably know all of the numbers even on that. I would love to know more about what are they waiting for? Why aren't they doing it?
In my experience, and Dr. JJ can piggyback off of this as much as she'd like, because I think she has a lot of experience in this arena as well. I think the two biggest factors are lack of education and fear.
Okay.
I hear it from women all the time. If I don't go in, they're not going to tell me something's wrong.
Mm-hmm.
Yeah.
So that's number one.
That's a big one.
And I would guess that's probably in healthcare industry as a whole.
Yes.
People are
Yes.
just afraid.
Fear's
Everybody has the
paralyzing.
parent
Yes.
or someone in their life.
If we
that just doesn't
ignore
do
the
goggles.
problem, it doesesn't exist.
Right.
And that's unfortunate, because then those are the ones who are coming in with late stage disease. And education has to be tireless, and it has to be almost to the point that we are shoving it down your throat of how important this is, how life-saving these measures are.
Yeah.
And and women can talk about other screening measures. Thermography is one. I had a patient who called about thermograms just yesterday. And, I said, that's, with all due respect to other avenues of doing breast cancer detection, thermograms are voodoo. Yeah. And I said that in the nicest way possible to the patient. I said, this mammography is what's been studied. It is the standard of care. It is the gold standard for cancer detection. I said thermograms are positive. They use a heat source to evaluate the breast, and they get a cute little printout of their breasts, and it'll show if there's a heat source, because cancer should provide heat. However, cancer has to be pretty large to be providing heat. So thermograms are typically not positive until you have a very, very, very large cancer in the breast. Sometimes to the point
we want to know earlier.
Yes.
Yeah.
Yes.
Okay.
Yes. So get your mammograms done, get the education, and educate people around you.
Yeah.
I feel that women carry that role in life, in our community, worldwide. We are the caretakers. Yep. We take care of children, we take care of spouses, we take care of parents, we take care of each other. And get your girlfriends, get your mammograms done. If you know your mother hasn't had a mammogram, say, Mom, let's go get a mammogram done. Just like women meet at the nail salon and get their manicures done, their pedicures done, make it a once-a-year ritual. Get your mammograms done.
Make a day of it. We talked off camera a lot about having a party around it or inviting your friends. And I wasn't sure if that was even an option. And you guys filled me in that it is.
It is.
And it's, get your 5 besties or your mom and your sisters or whatever it is, have everybody go together. And I think, especially Methodist, the breast care center at Methodist, it's like a spa in there. It looks so nice.
It
like
is
you walk
nice
in, you're
down
like,
there.
hello, I'm so happy you've greeted me. This is lovely, and I appreciate your.
things
I
down
know.
there.
Yes.
So it has that same kind of caring, lovely vibe. It's not so sterile, and it is. It just doesn't have that feel, that stark look.
Well, that was our goal in establishing the center. We know that women feel scared. We know they feel vulnerable. Sometimes we are the face that changes their life.
Yeah.
And
Over
that's
and over.
that's a big load to put on your shoulders.
It is.
And we want to make it as comfortable for women as possible. And know that they have a supportive staff there. I'm there almost every day. And they have us to kind of walk that road with them if it were to happen.
Right.
And if it doesn't, then wonderful.
And we're celebrating
yes.
with mimosas.
We'll
or
see you
whatever
next
that looks
year.
like. Yes,
Yes.
of course. Okay, that's wonderful. So I want to learn a little bit about, and we'll come. Oh, yes, please go ahead.
No, I just wanted to, because we didn't talk about all of the barriers.
Yes.
Right. And I think we kind of
Yes,
need to revisit
please.
that because that's important.
I think that's a huge part of the conversation.
Yeah. So fear, absolutely, of the unknown.
Yeah.
Sometimes that fear also can be because of what you do know. So I have a group of women who come in and they say, well, my grandmother died, or my mom died, or my aunt died. And that's why they delay coming in. So one of the things that we want to make sure is that women understand you are not your mother's story. You have your own story. Okay. And
Well
so,
said.
you really just have to empower them in that way, that you're here early and dispelling that fear inside of them. Other barriers that we see and we underestimate are proximity to adequate health care. So it's a very keen difference if you can get in a vehicle and drive 15 minutes to the breast center. But if you live in the outskirts of some of our counties and you don't have a car, you don't have transportation, do you feel boxed in? We have resources at the breast center to help with that. Okay.
You guys will literally get them a ride, correct?
We do have a social worker and breast navigators that can help us with transportation.
Yes.
That's incredible.
Both to get you to your mammogram and also if you're diagnosed with a breast cancer.
Yes. To get to therapy.
Yeah.
There's a strong breast navigator network in Northwest Indiana. So I think sometimes people build these blocks of impossibility in their own minds, and we're just here to break all that down.
Brilliant.
We're here to just break all that down and to explain to people that just because you feel like you can't get there, we can help get you there. Another thing that I think is also important are language barriers. We have more Spanish-speaking people in Northwest Indiana than sometimes we probably underestimate that.
Yeah.
And the only reason it's kind of more keenly in my worldview is because my children go to a dual language school and I see the moms and the grandmoms. So we've got to make sure too that we're making sure that our materials are in other languages and that we're providing access in that way. Because if they can't read and can't understand what we're sharing with them, then we're not reaching them.
We can't teach them. Yeah. And if
then-
you can't teach them, then it's not going to work.
You can't reach them. And another thing that I learned, because I've only been in this area for 8 years.
Okay.
Another thing that I've learned is generational illiteracy exists in Northwest Indiana. Okay. I have patients that come, and you've seen these patients.
Yes.
They are our age, they're in their 40s, and they have like a 6th grade education. So we can give them something that's very standard, right, for an adult, but it has to be distilled. The information has to be shared from somebody that they trust so that they actually get it and follow through. So that goes back to the medical home. It goes back to when you're talking about your friends and your circle of influence. Your circle of influence may not be people in your same socioeconomic group. You have to extend your circle of influence to people that may not be able to read what you can read. That's just like the reality. And I'm not trying to
Smart,
bring
but
down the
it's not something we
memo and
think.
mimosas, but
No.
this is the real. And if we want to deal with how we can actually make change, it's going to be trying to reach a little bit beyond our inner circles to people that may not even be able to read.
Yeah, that's brilliant.
Got to reach them.
And all of us could, right?
And all
Yes.
of us
because
can.
all of us have that reach, and all of
Yep.
us can just extend it a ring or two,
Just a little
right?
bit.
Just bring
Yes.
in
Just a
some
little
other
bit.
folks, and then
Yeah.
you can reach people that wouldn't have been reached.
So how do you do
before.
that? At your salon, the girl doing your nails. You do that at your church, the people serving you at the restaurant, the people that are just people that you wouldn't even think about. Have you had a mammogram? Just make it conversational. make it very casual.
Yeah.
You know, it's not all on, you know, the person. All the impetus is not on the person. Sometimes they just need a little extra information from community members.
Yeah, and we have so many community members. Even ourselves. I have an audience because of what I do every day for a living, right?
you have
I
a
get to run this
platform.
platform of Positive Only News, and it gives me a platform to talk to thousands of people, and right around 50% of women. So how do we ensure that we're speaking to them, number one, all of them, and in a manner that works for all of them, and letting them know what I've learned about it through this company, what I've learned about our community the most in my 10 years here is there is almost always a need, and there is almost always something to help that need or fill that need. And it's just that the hands aren't
bringing
talking.
it together.
Yeah. The left hand isn't talking to the right hand. They don't know the program's out there, and these guys don't know that person's out there in need. And how do we connect that? And I think that's very similar here, where you just have to ensure everyone hears the 99% rate, right? That's incredible. 99% curable at early detection.
Absolutely.
And then can you tell me a little bit about what that means on the other end? Stage 4, what's the rate there? Is it worse? I would assume it's harder to come back from. So if you've got the 99% early detection, get there.
Yes.
Let's get in then. Because
we don't want the stage 4.
And we don't want that.
No, we don't want the stage 4.
Yeah. Really good input. That's incredible. So we know why people aren't coming in. How do we fix that? Education, it sounds like. Keep talking. Say it louder. Say it to more people. Say it more often.
Yes. Be an example.
Be an example.
Yourself.
And then I'm going to be all over social media when I go.
Yes.
Telling everybody,
share your experience.
Internally.
Yeah.
You could literally, and I think the extension is very important too. My idea was, why don't we I'll start a Facebook event, and then who can go, and then we'll set up the appointments really early so that it's like, hey, I'm gonna go on, October 15th or whatever, and I'm gonna set it up today, and everybody respond and let me know if they're in.
Love
and then you get 10 people and you do that.
I think that's
wonderful. Then how do you bring that ring out again and say, okay, I already had mine, but who didn't? Well, and I'm going to get you guys together. I'll even show up with you.
Yeah.
But
it kind of reminds me of when they did the ALS challenge, and you call out a couple people and you say, okay, today I'm getting my mammogram. Now I'm calling out on these 3 people to get your mammogram as well, and they have to make their post. They call out 3 people as well, and that's a great way to spread the news. I love it.
Yeah. Because I think one of the other things that's not really mentioned, or yet anyway, is the time constraint. I think as women, we tell ourselves,
I don't have time.
I don't have time. I don't have time because it's for me.
Every day.
I do too.
I don't have time.
Multiple times a day.
I don't have time to drink water.
Yeah, I know.
I don't have time.
Right? We say all of it. You're 100%. I'm like, I didn't have time to get to my water today. What? How could that even mean? You literally need it to live. Why are you not drinking water? But I think often, especially moms, but women in general, we're giving a lot. That's who we are as people oftentimes. And so it doesn't come back to us, and we don't have time for us. And you have to make that time. And hopefully, if you can make it fun.
Much like unlike the excuse of working out, which should be every day, or drinking water, which should be every day. And I'm very queen at both of saying I don't have time. A mammogram is, if you can devote 20 minutes once a year, that's all it is.
Yeah.
It's 20 minutes once a year.
It doesn't take long, right?
No.
If you can get there, you can get it done, and you can get out of there.
Tell me about money. Obviously, all things cost money. I think Methodist specifically, but I think most healthcare entities will help you with that, correct? If I can't afford it, or if I'm afraid I can't afford it, you guys help.
We are definitely fortunate at Methodist hospitals to have grant programs. I can't speak on the other hospital facilities, what they have, but I would like to think that they do have programs available to help patients. Insured patients, your insurance will cover a mammogram every year. Medicare, your mammogram will cover, your insurance will cover a mammogram every year. If you do not have insurance, or you are underinsured, at Methodist, we've had a partnership with the Chicago Bears Care Foundation since 2013. This is the beneficiary arm of the Chicago Bears that gives grant money to multiple entities for both breast and ovarian cancer. We are the only hospital in Northwest Indiana to have partnered with the Chicago Bears, and we have received over $200,000 in grant money so that women who are either uninsured, underinsured, and we're talking women who live below the 200% federal poverty level in Northwest Indiana can get a regular screening mammogram, which means I don't have any complaints, but I should just get my mammogram done. Or if they have a complaint, I feel a lump, I feel pain, that's a diagnostic mammogram. It will cover the diagnostic mammogram. It will cover the ultrasound. It will cover the biopsy. It will cover the MRI. All of that is taken care of. We also have a partnership with the Legacy Foundation and the Pink Ribbon Society for women in the Gary community specifically to get screening mammograms done. It's available. It's available. And I'll just keep talking about them until all the money and all the resources are used up, because then that means I'm doing my job.
How smart. Yeah. Because I think that's scary for people too, is you just don't know. And healthcare oftentimes what you're getting into until the ball is already rolling and you kind of feel snowballed a little bit. But this sounds like you can figure out a lot of that ahead of time.
Yes.
That's lovely.
And for a lot of women who worry about their deductibles, and I know some private insurances have astronomical deductibles, most breast care facilities will offer a out-of-pocket cash $99 special a lot of times of the year, especially in October for Breast Cancer Awareness Month. We also do it in May for Mother's Day. It's a $99 special. You don't want to worry about your deductible, $99.
You don't even have to. Okay. You mentioned, and you guys guide me as well, because you know more about this conversation than I. You mentioned care coordinators. Tell me a little bit about what that means, because it sounds like someone that can definitely help that process. Yes, the breast navigators. Tell me what that means, who that is, what they do, how they help.
So we never want women going through a biopsy process or a cancer diagnosis to feel that they are out in the middle of no man's land and they have no idea where to start. And that's what our breast navigator does. They meet with all biopsy patients. If it's a benign biopsy and there's no cancer, fantastic. If the patient has anything atypical, abnormal, or a cancer, then that navigator will help facilitate, get them their appointments with a surgeon, with an oncologist, with a radiation oncologist. We don't want to feel that anybody is falling through the cracks, that we are delaying care. Our standard of care is we typically try to have, from the time a diagnosis is, if the patient doesn't need chemotherapy prior to surgery, we want a woman to be having her lumpectomy between 14 and 21 days after diagnosis. We want to get this out of your body. We want to get this moving. And our breast navigator helps with that. They help with education. They help with resources. They work with social workers. They talk to our high-risk patients and talk about, you should probably do some genetic testing. You should probably get these additional screening tests done. They have a very important role in our world.
Yeah.
I appreciate them. You know, sometimes I've had difficult patients that, for whatever reason, they didn't act on their biopsy results. And when they did finally come and see me, they kind of get lost. I've had breast navigators pull those people back in. They just have a way of encouraging them to walk through the process, that they're not alone. I've had people who didn't have transportation, that they've helped them to get access to their transportation back and forth. It's been just really good to have the breast navigators. Yes. They help with communication. Sometimes there are things that the patient doesn't want to necessarily talk to us about initially, and then they share with the breast navigator, and then they come to me with that, or other providers, and then we're able to more effectively communicate with the patients. So they're very useful.
And you touched on it, and I think you both have already, but what happens? So worst case, I'm going to be responsible. I go in and have my mammogram and it shows something. What happens? Because I think that's probably maybe something that hinders folks, is if they say it's positive, what goes on from there? What can someone expect in that situation, do you think?
I'll let you, because I usually will do the biopsy, and then after that they may see Dr. JJ.
Because I would assume there's some different.
But a lot is going to be dependent on what the biopsy shows.
Sure.
Right.
Not every breast cancer can be put into a box and a flow chart where everybody goes in the same direction.
Great point.
It's very individualized. And I think it's important that we kind of even talk a little bit about the biopsy experience. So if you can just kind of speak to that for a moment, and then I'll take it from there.
We have a couple different ways of biopsying patients. With every way that we biopsy, you are awake. It's not surgery, so we're not putting you under anesthesia, but we do use a local anesthetic called lidocaine. It's the same family as Novocaine that the dentist gives. And we numb up the skin, we numb the area that's going to be biopsied. Sometimes, just depending on the size of the needle, we may need to make a very tiny cut. It doesn't require stitches. Sometimes we don't have to make a cut at all. We put a skinny needle in. We take some pieces of tissue out, enough for a diagnosis. That's sent to pathology. It's typically a couple business days to get the results back. We always leave a little clip where we take the biopsy from. We do that for a couple of reasons. If there's anything abnormal, we've left a landmark behind, and then that will become Dr. JJ's target for surgery.
Smart.
If it's a benign biopsy, the clip stays in the breast. And when the woman comes back year after year for her mammograms, whoever is interpreting the mammogram as the radiologist will know that she has had a biopsy done in that area.
And then it can almost kind of point to, hey, check here first,
Yes.
sort of thing. Okay.
Exactly.
Brilliant.
And as a prior patient of Dr. Siatras's, a moment of transparency, that numbing of the skin does hurt a little bit. I'm not going to pretend it does not.
Thank you.
But it's the pressure. Like I would want to prepare patients for that. I did feel pressure.
Yes.
Okay.
And so that's kind of like if you're getting dental work done and it's not sharp pain, but it's disconcerting. It's uncomfortable.
Sure.
So that was about the extent of that.
Not
So,
terrible, but it's
Not
there.
terrible. It's there. So, we're big girls.
Yeah.
Okay. You wear your big girl pants for biopsy, right?
Yeah.
And you just prepare for that.
And that's helpful to know. Yeah. What
It's
you're getting
helpful
into.
to know that there will be pressure. Now, after the tissue is sent to the pathologist, then they will either come back and say this is a benign lesion, a high risk benign breast lesion that they recommend is removed from the breast, or they will say it's a stage 0 breast cancer and beyond.
Got it.
Okay, so at
So
that
you'll be
point,
somewhere in that.
you'll be
spectrum.
somewhere in that spectrum, and then at that point we will have to come up with a care plan. Right? So generally, there's a conversation between the patient and their primary care provider, or the patient and the breast navigator, and sometimes Dr. Siatras is even able to give the diagnosis to the patient.
Yes.
And
Got
so
it.
then they come to me and we talk about next steps. Everyone it's not cookie cutter. Breast cancer is very patient specific, risk factor specific, stage specific. Early breast cancers, we're able to offer breast conservation. You get to keep your breast. I gotta get the cancer out. I have to check the lymph nodes, but you get to keep your breast as long as you commit to the entire treatment plan.
Got it.
Which can include other things like radiation or chemotherapy. So it can get very complicated. And I tell people we're not going to put the cart in front of the horse. We'll get all of our information. We'll come up with a care plan.
Okay.
So that's early breast cancer. I have patients who have middle of the road to later breast cancers, right? Meaning they may need to have what we call systemic therapy first. If a tumor is of a size that it's larger, I hate to get technical, like a stage 2 or a larger tumor, and we're concerned that there may be cancer in other places, or they have lymph nodes that are positive, then those patients may need to have the entire system treated. I mean, you got to treat the whole body. Yeah, you have this thing in your breast, but it has legs. It has the ability to walk. So we're going to now stop its ability to go throughout the body with medicines that go in your vein. Okay, and an oncologist is in charge of that. So, this is all very technical, right? But we do try to break it down based on the patient's stage.
And I think it's helpful to just see some of those, to kind of say, here's that process.
Exactly.
Yeah, I like that a lot. I think that that's helpful just to go, okay, I can kind of see that map. And I think that's really helpful. Hot button points that I haven't brought up yet. I should probably just ask that right now. Is there anything that you really wanted to make sure? I've got more questions, obviously, but are there, within this process, if you think about early detection, the process that happens within detection, anything I didn't mention?
I think we've hit the hot points.
I think we really did.
Yeah,
That's really
we've
good.
hit the hot points. Get it done.
Good.
Get it done.
Get
it done.
early.
Get it done.
Get it
There's
done.
Great outcomes
There's
if you get
apparently
it early.
no excuses because you guys have all the answers. So that's number one. They will help you
I'm
through
not gonna say
anything
that.
else. Yeah. They will help you through any reasoning why you might be afraid
Yes,
or why you
yes,
feel like you
yes,
might not be
yes,
able.
yes.
You guys will help. Call, right? It's just
Right,
kind of
right.
call and talk to those folks and see what they can help you with. Tell me a little bit about the after. So if someone's diagnosed, they have some sort of treatment, whether that's chemo, whether that's mastectomy, extreme or not. How does that, what goes after that? Kind of the life after, if you will.
Well, any woman who has a lumpectomy, so just a portion of her breast tissue removed, she still comes in for her mammograms every year. And we always evaluate the mammogram while the patient is still there before she leaves. If she needs anything additional, we do it right there on that day. She's always kind of, we're never going to let her just leave and say, well, we'll get back to you on whatever your results are. Any woman who has a history, her mammogram will be evaluated that day.
Okay.
Typically, when we worry about cancer coming back in those patients, it's usually within the first 5 years. It's usually close to where they had the surgery done for the original cancer. But we always take a look at those women. Any woman who's had a mastectomy, we don't image them any further. There's no breast tissue left. So unless they happen to feel something new, we could do an ultrasound for that. Otherwise, mastectomy patients don't come in for mammograms anymore.
Got it. Wow. I want to touch on a little bit about both of you. You know, our so if that's okay, we have, you know, our main premise with All About the Girls is getting to know women in our communities, that whether they serve the community, they're part of the community. I think it sounds like you both do both. Just tell me, Dr. JJ, you can start. Just give me a quick glimpse into who you are as a woman. Just a little bit about you. As personal as you want to get, but you don't have to talk about the kids that you yelled at yesterday or anything like that if you don't want to.
All about the girls. So let's see. I'm not a native of Northwest Indiana. I'm a native of Arkansas.
Okay.
So I'm a Southerner. I was trained at Xavier University for college, Meharry Medical College in Nashville for medical school, and then general surgery at the University of Cincinnati.
Fantastic.
I initially thought I wanted to be a pediatric surgeon because I love children. But I met my husband out west doing research, and I said, you know, I'm just going to be a surgeon and a mom. So I came back to finish general surgery in Cincinnati and broke all the rules and had children as a resident.
I was just going to say, a mom and a surgeon, both sound terrifying.
I got married in residency.
Wow.
And had 2 children in residency. Yes. So
I don't know when you slept.
Anything. Girls can
Girls
do anything.
can do anything.
Yeah. So with one of the boys, I can't remember which one because there's not a lot of sleep, so there's some like memory issues. But with one of the boys, I had to come back after 5 weeks to be on the service. And I remember being on the trauma service. And as the chief of trauma, you are responsible for any sick patient that comes in with, you know, a car accident, a gunshot wound, all that. Now there's attendings over you, but you're it. And I remember that there was a tiny little closet behind the trauma bay where I put my lactation equipment and I would pump because I wanted to do just the motherly thing. Yeah. In between traumas. Insane, right?
Insane.
But it was very formative. And I think it actually made me a stronger person to have to go through that. There wasn't a whole lot of support for women in the program or people of color in the program. So at this point in life, you could punch me in the face and I just bounce back. Wow. So it's really okay.
Well said, and I believe it wholeheartedly.
Yeah, but there were challenges there, of course. And even my path to Northwest Indiana was kind of paved by one of the senior residents at the program who knew me well. And when I graduated, my initial job at my dream job was to go back to Meharry Medical College in Nashville, and that job fell through because there was instability there. And I said, well, I have a 1-year-old and a 2-year-old, and I don't have a job. I made general surgery without a job. And I had my board certification, everything. And then Dr. Thomas Shin, who is a member of Indiana Surgical Associates, was like, get your butt to Northwest Indiana because this group is awesome and you're gonna have a great time. So I came into the group as the first woman. Dr. Tom Galuzis is a name that I know it's all about the girls, but it's a name that people in Northwest Indiana should know because he has developed and groomed one of the most diverse groups of surgeons in the country.
Amazing.
Okay. And it started with this little black girl from Arkansas, and he now has several women and all sorts of different types of people. And so I get to be my best self. I get to be a surgeon, a general surgeon. I get to do the whole gambit of what general surgeons get to do: hernias, gallbladders, breast cancer, colon cancer. Wow. And I get to do my dream job, you know, and be fully supported by a group of surgeons who accept me for who I am. I get to be a mother. I have 4 children. I'm married to a great stay-at-home dad who kind of defies all of those like social norms and does the things that, some other dads might kind of like, well, you're not really a man's man doing that. But he's like, look, I can take the kids to swim. I'm happy to go to the Y. So I get to do these things fully supported. I have other interests. I participate with Alpha Kappa Alpha Sorority Incorporated, which is one of the largest African-American sororities in the country. And I get to perform the best community service in Gary. And I say the best because we compete with other sororities. So, so we all do good work, but I get to say we're the best.
But yours are the best.
And so my pink and my pearls is Frey K.
Okay, that's fantastic.
Yeah, that's a lot of fun. And that gives me balance to be able to work with other women who are leaders in the community, in the heart of Gary, but we expand across the region. Incredible. And then also I'm a baker. So I just recently started a home baking business on the side.
When do you
There's not a lot of room on the side.
How do you do? I was just going to say, I don't know how you do all of this.
The reason that you do it, the reason that I do these things is so that when I do show up, and when I do have to give people bad news, when I do have issues that I cannot control in the operating room, I have a safe place, right? Yeah. I have a place to fall back to, and that's my gifts and talents in my own hands, right? My baking, my sewing, my gardening, all that stuff feeds my spirit because it's hard to do what we do. We have to tell people bad things every day. So I think as mothers and providers, we don't have safe spaces. If all you're doing all day is working and going home and going to sleep to try to sleep it off and try again tomorrow, and you're not feeding your spirit, you're going to, what did my daughter tell me the other day? She said, Mommy, you're all poured out.
Oh my gosh.
You're all poured out. She's
I want to cry. And she's spot on.
She's spot on. I was like, okay, I'm going to do something fun. I'm going to sleep tonight. And then tomorrow I'm going to do something I enjoy doing. That's why I do all those other things.
Brilliant. And it's a great way to, have some balance. In an unbalanced spot. Yeah.
Yeah.
How about you, Dr. Siatras?
I grew up in Northeast Ohio.
Okay.
Went to med school. My husband and I have been married for 22 years. We met in college.
Incredible.
We both went to med school together. We went to Midwestern University in Chicago. We did our residencies at the same hospital. He did it in general surgery. I was radiology at St. James Hospital. I did my breast imaging fellowship at Ohio State. And then we started looking for jobs together and ended up in Northwest Indiana. We also had a child during residency.
You guys.
Love it.
Yes.
So
and not
hard.
truly a supported decision by other people, but there's never a good time. You just have to do it.
No, you're right.
You just have to do it. And I got pregnant with my son when I was a fellowship and my husband was doing his fellowship somewhere else. So, and then we started working. And so we're in this wonderful, chaotic mess of working, caring for patients, raising 2 children who are now 15 and 10.
Oh my gosh.
And they are, I think, what keeps us going. We have family. We love our families. We take care of parents. My parents are aging. My father is 93 and a half.
Oh my God.
And is planning a trip to Greece August 20th. So
How cool is he?
He is
Oh my
very, very
gosh.
inspiring to me every day. Yes, he's amazing. And I have an amazing mother next to him. I'm involved with our church, and I try to just keep my pulse on the community, as much as I can. I think that's what it is. You're a woman who works here, who lives here, who feels here. You just have to be ingrained in all of it to make a difference. And that's what I feel that God has put me here for. It's, to make a difference, maybe in one life, maybe in a handful of lives. But that's what keeps me going. And hobbies, my children are my main hobbies. I always say that my hobbies will really start when they leave the house. Because I think
we have to listen to her over here. Dr. JJ said it right. You got to find a little something.
A little bit.
Just a
little bit. I always say, I'll leave a few years till she leaves the house. And I try to soak up all that time. Yeah. I do love spending time with friends and with family, entertaining at my house, cooking, doing all those. I love having an open house and just people coming over. That. We're Greek, so it's always a party, always food, always beverage. Everything is big. So yes.
I don't have children, and I think that's why I love that aspect of life. Is like I want friends to come over. I want them to spend the night. I want to get up. I want to make them a big breakfast. And then I want them to go home. But I really love that.
Yes.
Like I want them to be sitting at the table, putzing around while I cook and
The
chatting.
fellowship.
I love that. Yes. The fellowship of the kind of morning after that big party, or that the fellowship that comes with kind of entertaining. I think it's just magic. Yeah. I love that. Tell me, what would you think, what can we do different? If you had advice for everybody, what advice would you give to all of the women listening, all of the people listening? What would that advice be?
As it relates to?
I would say women's health as a whole.
Women's health.
If you can kind of relate it to women's health, what you've taught us today on breast health, what you're teaching us even just personally about your own lives. But I think taking it from the health perspective, what advice would you give to all of our listeners?
Be proactive.
Proactive.
Be proactive.
Okay.
Start early. Start with yourself. Talk and listen. Be proactive.
How about you? Same?
Same. And advocate for yourself.
Oh, yes.
At some point,
at
some point
harder.
in time, you may find that someone isn't hearing you, isn't listening to you. I always tell women, no one knows your body better than you do. And if there's something there that just doesn't feel right, advocate for yourself.
Yes.
Advocate for yourself.
Call,
get questions.
ask, talk more.
Get it answered. You're worth it. You're worth it. And sometimes we have to be our own advocates.
That's true. When something's wrong, something is wrong.
And you're right. I think no one knows your body like you.
Yeah.
I just had this conversation with a friend of mine, and same thing. She said, well, I went to the doctor and they said, this. And okay, but if you don't think that's right, ask more questions. Go back. Go to somebody else. Get a second opinion. It doesn't matter. It's not, who cares? Is it going to hurt somebody's feelings? I don't think so. And if so, who cares? It's really the important part is making sure that you get found out. You get someone's there supporting you the way that you should be, or the way that you feel is necessary. Yeah. Do you have a few minutes for some fun?
Maybe a couple.
Okay. She's like, no, don't take too long.
How
This
much
might get
fun?
hard.
How
Okay,
much
so we
fun
do
you
some
having?
quick response questions. I'll just have you guys shout your answers. Usually we have a buzzer. It's very intense, but with two folks, I won't do that. Exactly, yes. Okay, so these are just really fun questions. Shout out your answer as fast as you possibly can. Would you rather have telekinesis, which is the ability to move things with your mind, or telepathy, the ability to read minds?
Telepathy.
Ooh, both of you. I love that. Look, everyone says telepathy. I do not. I don't want to know their opinions. I don't want to know because
want to be shocked?
me, and I don't want to hear about it.
No,
Okay.
I hope they don't know what I'm thinking.
Know what I'm thinking.
And I don't.
face.
Yeah. You just can't. Yeah. Watch your face. Yep.
Watch your face.
If the old you could see the new you, what would the old you say?
Girl, you did it.
Oh, great answer.
Oh,
She's like, "What crap? I liked her answer."
yeah, I did. That's good.
Or you could say, girl, you did it.
Either way. It depends on the inflection.
It depends on the inflection. Did it? Okay.
What were you thinking? Yes.
There we go. Yeah.
Oh my God.
Would you rather be chronically underdressed or overdressed?
Overdressed.
Overdressed.
Oh, amen. What woman would you want to have on your side in a battle royale? That's fights to death.
Oh, my mom.
My mom.
Oh my gosh, you guys are amazing. You now own a billboard. What does it say?
God loves you.
God, oh, I love that.
I love that.
I'm sorry for talking. I thought we were supposed to go fast.
No, your brain is clearly working much faster than mine is. There you go. I think that's it. I think that's
protein
it.
and caffeine. So.
See?
I don't know. I have to come back to that one.
Get your mammogram.
Get your mammogram.
Get checked early.
Yes.
Yes. Would you rather have the ability to see 10 minutes into the future or 150 years into the future?
I'd say 10 minutes.
Look, she's like neither.
I don't want to know.
10 minutes?
10 minutes. Yeah, 150 I think is
kind of scary.
That's scary to me.
It's like, what's the point of everything?
Yes.
Especially if you have children and then
just-
they might have children and it
I
just
don't
gets
wanna know.
messy. Yeah.
Yeah.
When do you pack for vacation?
The day before.
Multiple days before.
I'm
a planner.
I'm a last minute.
You give me an
In
ulcer.
fact,
My
Jonathan
husband
packs
does
for me.
the day of.
Does really?
My husband packs for me. The last swim
that's
trip he
amazing.
packed for me. Now I did not have matching things, but I was clothed.
I love it. That's okay. That's all that matters. It's
I
vacation.
didn't even
right?
have a Valpo swim mom shirt. It was just a shirt that had green in it.
Well,
It was okay.
It's okay. You
He
had
pegged.
close. You had close. What superhero would you most want to be?
Ooh. Oh, what's her name? Wakanda's girl. The girl that ended up being the girl who was
superpower. Do you know
Black
this?
Panther, the Black Panther, but the girl version.
Yes.
I don't know.
I
the
can't
name.
remember her name.
I can.
I
See
remember
her
the
face.
actress too. But
my kids would
yes.
be so mad at me.
Yes, I remember the
She
actress.
was.
I love
Yeah.
this answer.
Oh,
Good one.
I'd have to say Wonder Woman.
Yes.
I don't
You
know
very many
stretch, though.
superheroes.
Yes, I don't either.
honestly.
What is her name? I feel terrible, but yeah, that one.
Okay, I love that. Would you rather be forced to sing along or dance to every song you hear?
Sing.
Ooh,
No
both.
dancing.
No? No. Look,
Horrible
no.
dance.
Okay. What,
There's too many elbows.
Too many
It's
movements.
just not. Yeah.
Yeah.
do you
not good.
prefer being extremely hot or cold?
Hot. Bring the heat.
Hot.
Bring the heat.
Hot. I don't like
You
cold.
can kind of.
I'm with you on that.
Yeah.
Anything else that you guys? Oh, here. That's the end of the speed run. You made it through.
Okay.
You
Woo.
made it through.
We're done.
Anything else that we haven't touched on today that you want to give to our audience? Anything else you want to mention? I know this is like we only.
I wish I knew more about the mobile mammograms. There are several mobile mammogram programs in Northwest Indiana. One is with Janet Seabrook and HealthLink, and there's another one with AKA. And I don't know the actual information. So do you know?
No, I do not.
Because those are good.
they're not technically through Methodist. Is that why?
No, they're
okay.
not. That's
but
why.
then that's a great
But
point.
there
Though
are
we
mobile
can.
mammograms.
Yeah,
that
let's
will
have
go out
people
into
can
the
Google.
community so we can look look
Yeah.
into that.
Yeah, look that up. That's a great point. Because then
Yeah.
that's basically they'll park. It's almost like a blood drive, right? Like they'll park here, and you can go right downtown Valpo or wherever they're parked and
Yes,
have that
yes.
done.
And for me, it's as much as I would love to see your smiling face cross through Methodist's door, and you could see
Doesn't
my
matter.
smiling face as well. There's a breast facility everywhere.
Yes.
Just get your mammogram done. I just
Exactly.
want to make sure that the women in our community are getting appropriately screened, and that's the only way that we're going to decrease end stage or late stage breast cancers.
Exactly.
Smart. And do you think? Quick question on that. That was a great point. So we mentioned, mimosas and mammograms. If we do that, so I would bring some friends from maybe a little bit of everywhere. And this worst case, something comes back, they can utilize that through their regular healthcare provider, correct? Like if they're from Chicago and they usually go to this hospital, or it doesn't matter where they have that mammogram done, or should they stick with that home base?
I usually like to tell patients to stick with their home base.
Got it.
Yes.
Sure. No, that's great
it's
advice.
hard when you get women kind of hopping from one institution to another.
Sure.
Then you're not sure if you're really getting all the information. So I think unless you're unhappy with where you are, then just get all your pictures, all your images, and take them to where you feel comfortable and where you feel happy.
I love that. Great advice. And how do people connect with you and your company? How do they find you? Is that online? Is that through Methodist hospitals? Tell us more on how they can connect with you guys. LinkedIn, what's best?
We're online.
We're online.
MethodistHospitals.org.
Got it.
Indiana Surgical Associates is also online.
Fantastic.
You can get myself and all the other great surgeons in our group.
Yes, MethodistHospitals.org, and they have coverage about the breast center and all the people who work there. So yes, you can
Including
get
you,
information, all the contact information, all of the campus information, so that all the facilities that are available to women.
And that's really incredible. So I have seen it multiple times. It's an amazing spot. So
Thank you.
get your mammograms,
Yes.
get early detection. It sounds like you've taught us a ton. Well, thank you both so much.
Thank
Dr.
you.
JJ,
Thank you for
Dr.
having
Siatras.
us.
Yes, this was great.
Of course,
This
this
is
is
really
awesome.
great. We talk all the time about how can we tell more people. So
And
this
here
is
it
a
is.
Perfectly,
wonderful
yes.
opportunity. So
Yes.
thank you.
Thank you guys.
Yeah.
And everybody else listening, thanks for listening. Thanks for watching. Tune in. Of course, next month we've got another incredible episode with some incredible stories. So pay attention next month as well. And make sure to tell the podcast world how much you like us, like, share, and all those good things. Take care, guys.